Hello there, my name is Dr. Carlo Oger. I produce medical education videos like this one. And in this video, we're going to be talking about high blood pressure. We've done other videos for high blood pressure in the past, but this one specifically is going to be about the numbers. What do they mean? When is it high? When is it very high? And when is it dangerous? And the most important thing when taking blood pressure measurements is that you have a device that's accurate because you want to have adequate data in order to make conclusions. A lot of times they are ill-fitting, they are cheaper blood pressure cuffs, and they give you these really high numbers or abnormal numbers, or the reliability between measurements is just not very good. So you definitely want a device that's FDA approved, that's been verified, and that is going to work well for you, that it fits well, and it's going to give you the numbers, but not only get you the right numbers, but also keep track of the numbers, either with the device itself or have an application that you can download the numbers and then you can share them with your physician and so on. So right now I'm using a device called Check Me, and they've been kind enough to give me a whole bunch of ones, which I'm going to talk about later in the video. But for now, let's talk about the numbers. And right now I actually have my blood pressure cuff going off and checking my blood pressure. This is not ideal because I am talking, I'm moving a little bit. You should be relaxed. You should be sitting back, and so that you can get an accurate, adequate blood pressure cuff monitoring. The best time of the day to check your blood pressure is first thing in the morning before even you get out of bed. So it's good to have this thing charged up, have it at the bedside, put it on and check it. If you do check it during the day, make sure that you give yourself time to relax, take a couple deep breaths, do a 30-second meditation or whatever, and then check your blood pressure. That'll guarantee that it's not abnormally high just because you've been moving around, your heart rate's up, you're stressed, you kind of have it, and then you get a good, accurate measurement. But let's talk about the blood pressure and what it means. I'm going to start by showing you a screen with my own blood pressure measurement, but it also shows you some color graded things, and we'll talk about that. So let's go to the screen. And this is my blood pressure. This was yesterday, actually, or a couple of days ago, and it's 130/93. That is high. At the time, I had not taken my blood pressure medication that day, and this is a moderately elevated blood pressure. So the first thing we're going to do is see that this is the app of the blood pressure cuff, sends the information to my phone, and then I can display it like it is on the picture here. It shows the heart rate, 77 beats per minute. So I wasn't fully relaxed because my fully relaxed heart rate should be in the low 60s or even 50s. So that can impact blood pressure. So if you're up and going and moving around and your heart rate's up, the blood pressure will be up 5 to 10 points above what it should be. The second number is the mean arterial blood pressure. That's actually the average of the two blood pressures between the systolic and diastolic. And this is the number the physicians use to direct therapy to see how much we're going to go down, because it averages over time the two blood pressures. And the pulse pressure means the difference between the systolic and the diastolic. And a very high pulse pressure or a very low blood pressure can mean different things. And this is something more advanced, more to deal with the doctor. But this is good data to capture and to monitor, to have available when you follow up with your doctor. As you can see on this graph, it'll show that little blue button where my blood pressure fell. On the bottom side, it goes down here, 0, 60, 80. That's the diastolic or the lower blood pressure. And the systolic is the high number, the systolic blood pressure. And you can see my numbers fall in that orange category. So we want the blood pressure to be green or blue down here. All right. A yellow means mildly elevated. Orange means significantly elevated. Red is, okay, this is getting to be bad. This is no good, no bueno. And then red means, okay, you should call your doctor. You should do something about your blood pressure. And that's the important thing. Yes, we can talk about the medical terms, and we're going to do that on the next slides. That's a grade 1, grade 2 hypertensive urges, your emergencies and stuff. But the good thing about this is it gives you a graphical color code for your blood pressure. So you don't have to remember the numbers. You just know that if your blood pressure falls here, is it just a little bit high, moderately high, very high, or dangerously high? And that's what's important. That's what you need to remember out of this video. So we move to the next slide, and this is from the American Heart Association guidelines. And it'll divide up into systolic and diastolic blood pressures, the upper number and the lower number. And you can see here also it's green, yellow, orange, orange, and then red. So you can see that 120/80 is the goal blood pressure. Actually, you should have a goal of even lower. 115/75 would be ideal. But 120/80, you're still okay. Any number between 120 and 129, or still less than 80 on the bottom number, it's elevated. It's a high blood pressure. But at that point, it is just a mild elevated blood pressure. Doesn't mean you are hypertensive. It's what people call pre-hypertension. You start to have some high numbers. And that's nothing that requires any emergency treatment. But this is the kind of thing where you should consider lifestyle changes. Most importantly, decrease the salt in your diet, decrease caffeinated products. Alcohol can elevate your blood pressure, stress levels, anxiety, make sure you exercise and things like that. Stage 1 and stage 2 hypertension, that's the orange and the dark orange. And those numbers are right here, 130 to 139. And on the bottom number, 80 to 89. And then 140 or higher or 90 or higher, that's severely elevated blood pressure. And you should be doing something about the blood pressure acutely to bring that down. Whether that be taking a meditation rest, making sure that day you have a very strict diet with low salt, drink plenty of water to hydrate and to lower your sodium in your blood. And if you take blood pressure medicine, perhaps take an extra blood pressure medicine, maybe call your doctor, get some advice. And then hypertensive crisis. Now, I disagree a little bit on this graph, but this is what the American Heart Association is putting out for people. So let's just call it that. If your blood pressure is more than 180/120, either number, you should be contacting your own doctor. You should be maybe going to urgent care. Most of the time, they'll end up sending you to the emergency department anyway. And the reason for that being because we want to check for end organ damage. We want to see if there's any injury to your heart, to your kidneys. Are there any signs and symptoms of stroke? We might need to do an EKG to look for palpitations or signs of ischemia. And this is when a good blood pressure cuff that does more than just blood pressure would be beneficial, because then you presenting to an urgent care or your doctor and you have data of showing your blood pressure over time would be very useful to the provider to make decisions about, hey, what's your blood pressure look like now? What's it look like the last few days? Is this just a one-time spike? And how to intervene in terms of, do you just need a little more medication or you need some more pertinent changes? So this is another graph also for the American Heart Association, what normal blood pressure is, less than 120/80, ideally 115/75. Elevated blood pressures at anything between 120 to 129 on the top, or 80 or higher on the bottom. Stage 1 hypertension is when you start getting numbers in the 130s or upper 80s, 90s. And stage 2 hypertension is 140/90. And that's a good number to remember. 140/90, that's stage 2. And then you get the 180/120. That's the hypertensive crisis or emergency. You're the one where you have to really go forward and get a medical evaluation, perhaps even call 911, especially if you do have symptoms like chest pain, headache, lightheadedness, palpitations, you feel faint or lightheaded. That's when you really need emergency intervention. So this video is about blood pressure. We talked about the different stages of high blood pressure, what the numbers are, and that you want some kind of easy way to remember. We talk about the 120/80 and then 140/90 as being those numbers to remember. And then, of course, 180/20. But you want it easy, right? So this is when you need a good blood pressure cuff that is accurate. And I want to talk real briefly about the Check Me, because they were kind enough to send me this blood pressure cuff. This is the exact one I use, but I use it on white color. And they sent me a green one, which looks kind of cool, but it's essentially the same thing. FDA approved. It saves all your data. The data communicates with your phone, which is what I was showing you guys here earlier. So all my blood pressures there over time, so I can track it. I can see what the numbers are. And it gives me that color code that I was talking about. That color code, whether it's orange, green, what the blood pressure is looking what, that's the month, year, and then you can do a month graph and stuff like that. So if I had to talk to my doctor, I would pull this up, I would bring it up, and so on. So this is the blood pressure cuff. It charges USB-C. The battery lasts forever. It is very portable and small, and you can have it in your bedside. You can carry it with you if you go on a trip. It really takes very little space. But one other blood pressure cuff that they sent me to evaluate is this other one. And it looks exactly the same, right? The color is a little bit different, but this is the BP2 with EKG. This is actually pretty cool, especially if you're having symptoms like headaches, feeling faint, palpitations. You not only check your blood pressure, but then you change the mode and you're going to check your heart rate. All you have to do is put your palms to the side, metal prongs, and it basically starts detecting your heart rate. And it'll go for like 60 seconds. It'll go beep, 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 beep. And what's really cool about it, it'll even give an AI analysis of the rhythm. So it will show up if you have PVCs, PACs, and so on. So if you do have high blood pressure and you're in the market for a blood pressure cuff, or even if you have a blood pressure cuff, but it doesn't give you the option to save the data or to sync it to an app, you're looking for a new model, I would strongly want to encourage you to get this one, the BP2 blood pressure monitor with EKG. It comes in white and it comes in black, BP2 Connect. And the reason I do recommend you do this one above everything, this one actually has an extra feature of accuracy where it takes multiple measurements and will give you the average of the best measurements. So it will give you much more accurate data than the other ones. Number 2, connects Bluetooth directly to your phone, saves all your data. Number 3, it has the EKG function so that if you ever do get atrial fibrillation, atrial flutter, palpitations, PVCs, PACs, or whatever, you'll be able to collect that data, bring it into the hospital or your doctor and show them. This is invaluable. A lot of times we have to make decisions about your symptoms and stuff and not have, what was your blood pressure when you felt lightheaded or dizzy? What was your heart rate? Were you having palpitations or not? If you show us this data and then you go to EKG and show us what you had, and then look at that, you have a full EKG showing normal sinus rhythm. That's very useful to the physician to make decisions. And then if you were to show atrial fibrillation, were to show atrial flutter, were to show PACs, PVCs, a sinus pause, because at the time you passed out, your heart rate was really slow, you had a heart block or whatever, this is going to be invaluable data. So check out the link below for the sponsor of this video. Check Me Connect. I would strongly suggest you do the blood pressure monitor with the EKG. You want the more data that you can, so you can bring it up to the doctor and you can make good, sound decisions about your care. I hope you learn about blood pressure, about the numbers, about having a good, accurate way to not only monitor your blood pressure, but to interpret the data and to have a way to log those numbers in and what those numbers mean. Were they green, yellow, dark orange, red, or real bad, So we'll see you in our next video. Thank you for watching. Bye-bye.